Alright, let's break down how to use Ozempic in just 2 minutes. First off, what is Ozempic? It's a prescription medicine used to help adults with type 2 diabetes manage blood sugar, and it can also help with weight loss. But don't forget, only use it if your doctor prescribes it. Using Ozempic is actually pretty straightforward. It comes in a pre-filled injection pen. You use it once a week, same day, same time every week. Pick a time that's easy to remember, like Sunday mornings with breakfast. Here's how you do it. Step 1. Wash your hands. Remove the pen cap, attach a new needle and twist it on tight. Don't reuse needles. Dial up your prescribed dose using the pen's knob. Next, pick your injection spot, your stomach, thigh, or upper arm. Wipe the area with an alcohol swab, pinch your skin, insert the needle and press the button to inject. Hold it for a few seconds, then pull the needle out and dispose of it safely. Now, how effective is Ozempic? Studies show it can help lower your A1C levels, which means better blood sugar control. Many people also lose weight while using it, sometimes several pounds over a few months. But results vary, and it's not a substitute for healthy eating and exercise. Side effects? The most common are nausea or stomach issues, especially when you start. Most of the time these fade as your body gets used to the medication. Always tell your doctor about side effects or if you have any concerns. So, that's the basics of Ozempic. Once a week, easy to use, and it can make a real difference for many people with type 2 diabetes. Remember, always talk to your healthcare provider first. Thanks for watching.